Well, let's leave that story now and move to another worrying story, which definitely makes the top story this morning. The health authorities, indeed, Democratic Republic of the Congo, definitely have come out to make mention that a new outbreak of Ebola is indeed in town. Now, they declared the new outbreak of Ebola after a case was confirmed in Mbandaka, a city in the northwestern Equateur Province. This is the third outbreak in the province since 2018.
Now, so far, so good. Just one case has been confirmed. The patient, a 31-year-old man, began experiencing symptoms on April 5th and after more than a week of care at home, sought treatment at a local health facility. On the 21st of April, the patient was admitted to an Ebola treatment center for intensive care but died later that day. Having recognized the symptoms, health workers immediately submitted samples to test for Ebola virus disease. Investigations to determine the source of the outbreak are still ongoing.
Well, the Democratic Republic of the Congo is experiencing its 14th Ebola outbreak since 1976. The current outbreak is the 6th since 2018 alone, the most frequent occurrence in the country's Ebola history. Previous outbreaks in Equateur Province were in 2020 and 2018, with 130 and 54 recorded cases, respectively. Well, joining us now is News Central researcher Babatunde Oguntimehin, who has been keeping track on this story. To tell us more, welcome to Breakfast Central, Babatunde. Well, about 4 months ago, the world celebrated when World Health Organization declared that an outbreak of the Ebola virus disease was over, completely over in DR Congo. But now a new case has been discovered. Can you bring us up to speed with the latest case?
Thank you, folks. Yes, it's very true that a new outbreak of Ebola has been discovered in DR Congo. Like you said earlier, this is the 14th outbreak that happened in that place. But what happened this time is that the last ones that happened made it 13. Now, this number 14th that was discovered just some few days ago happened when a young man, it's about 31 years, that was discovered. They said he has been treated for about 2 weeks at home before he was taken to the hospital. So, I mean, they feel it must have been spreading for about 2 weeks. But normally, when the World Health Organization says an outbreak of a case like Ebola is over, they always follow a set of rules. Like in DR Congo, the last case has to have turned negative about twice, and they must have waited for at least 42 days to make sure that no other case has happened. And this happened in December, but this one happened recently. But researchers say when the genetic testing was carried out, they discovered that it was from a new source and that it was definitely probably not from a former infection. So I think that's a very good thing.
Okay, Babatunde, you put the number at 14. What efforts are being put in place by health authorities in DR Congo to prevent this new case from degenerating into another outbreak?
Yes, since that isolated case has happened, a whole lot has been done in DR Congo. The World Health Organization African Regional Director, that's Dr. Mosisodi Moeti, said, confirmed that the health officials in DR Congo are the best trained in the world concerning the antecedents they've had in the DRC Congo concerning the Ebola virus, and that they are already on ground. Like when the young man that was said to have died from the infection, they sanitized all the health facility where he was said to have been admitted. They've been doing a whole lot of contact tracing too, because they said the last 2 weeks must have allowed that infection to have spread. So they've been doing a whole lot of contact tracing from one to the other. Those people we've had traces with in the last 2 weeks or thereabout. And they said they are also trying to revaccinate everyone that has been vaccinated last year, because they carried out an Ebola vaccination last year. So they are trying to revaccinate everyone and make sure that everyone is safe. They're also doing so many, some enlightenment to conducting enlightenment among the general public in DR Congo to sensitize people, letting them know that this kind of disease is coming up again, but they are doing the best they can to make sure that this doesn't turn into a pandemic again.
All right. Well, my question is quite peculiar. And why is it that Ebola keeps showing up in DR Congo? Why? Are you sure there's something that they are not doing, if at all?
Well, that's a very good question. But scientists have not really been able to pin what really causes some of these infections. But suggestions say that infected fruit bats are most likely the cause of like this current one. The field is from a host bat, and they've been doing all they can. Like in most of the forest areas, they try to fumigate, they try to sensitize and let people know this, but there has not really been a single case that has been marked out to cause some of these things. Like that, since 1976, that the first case was discovered. So many people have died. Even just between 2018 and 2020 alone, there were almost 3,000 infections with almost 2,000 deaths. This has been a very prevalent kind of disease in DR Congo, but for now, they can only prevent, vaccinate, and still before they finally get what is happening. But presently, there's still no real thing that causes Ebola.
Okay, generally, I know with the prevalence of COVID-19, a lot of people have said that more attention has gone to COVID-19 and away from other diseases. Do you feel so? Do you feel the World Health Organization is putting much more focus on COVID-19 and even the disease control agencies? Do you feel that focus has been shifted to only COVID-19?
I don't think so, because actually most of these organizations, like the World Health Organizations, have various facilities that are always ready for some of these pandemic or disease when they happen. Like in DR Congo, like this recent one that has happened, they've deployed vaccines. That shows they are always ready for some of these things. COVID came, it took a whole lot of attention really, but that doesn't really mean so many of all these other diseases that keep cropping up doesn't get the equivalent concerns too.
Well, thank you so much, Babatunde Oguntimehin, as you are keeping track with the Ebola case in Democratic Republic of Congo. We look forward to hear positive stories and reviews. Plus, hopefully, they can put a stop completely to the Ebola virus and why it keeps emanating from that particular country. We appreciate your presence here on Breakfast Central.
Thank you very much.
All right, so Rita, we've taken a look at the Ebola case. Plus, it's quite sad for me. The question really is, why is it always coming from DR Congo?
That's the same question I felt also. And, when I heard the news, Ebola outbreak, once you hear a disease or a virus outbreak in a particular African country, you're just scared. Because I remember the time we actually had Ebola in Nigeria. And remember that people were so scared. And I thank God for that medical doctor, unfortunately, who actually lost her life. But she did all her best to make sure that she contained the disease. So I would say that health ministries need to do a lot to contain this virus. And DR Congo has been doing well. But as you said, probably there's something they're missing. Probably it's environmental things or something that they really should do, because you can't keep on having an outbreak of the virus 14 times. We've had it in Nigeria and that's been all. Is it that we're not having track records of the diseases? Or probably, I know another thing is self-care, because we saw that the man actually had a self-care at home for about a week before going to the hospital. I think that should also be a question. I think most times for Africans, or generally, when you see symptoms of sicknesses, you don't necessarily go to the hospital. I don't know, probably we're scared of the hospital, or we just feel you can just take a paracetamol or Panadol.
Or possibly you just go straight for the herbs, agbo jadi, which is known on this part of the Western African continent, where leaves are being dissolved in water, cooked, boiled alongside with a bag of fruits and so on, and then left to actually ferment, and then you drink it. It's known to ease off sicknesses, especially that of malaria, measles, you name them. But is that really the case in taking care of Ebola virus? I don't know about Rita's thoughts, but my thoughts are
I'll leave it to the health experts, because I have my own judgment on things like that. Some people would say it actually works, while others would say, it's better. We have technology now, so that's why we have medical doctors. So why not go to the hospital? You see a sign, you feel you're feeling sick, why not just go to the hospital for medical care? Joy is laughing. I'm sure you've had a situation like that.
Just go to the hospital, man. Just go get treated.